The Bursary has essentially allowed us to produce 3 policy implementation guides for older people's services across the Trust. It was recognised that there was a lot of national guidance in relation to older people's services, a lot of expert research that was out there, but it was recognised that there was a lack of information on how to actually implement a lot of the guidance and some practical tips to operationalise services. The Bursary has been structured around 3 work streams relating to memory assessment service, engaging black and minority ethnic communities, and older people's liaison psychiatry. The project has been developed and delivered through 3 work streams, which have been functioning differently but have all been for a similar aim to develop the guidance. In terms of the Bursary itself, it's allowed us to release some capacity of clinical staff for them to get together and share learning. And the Bursary will also be used at the end of the project for us to launch this across the region with our stakeholders, chief execs and interested parties in a launch event that we're hoping to organise later in the year.
This project was about helping older South Asian women gain access to mental health services. And I think there's a lot of stigma around mental health, ageing, and if you're from a BME community, particularly if there are language difficulties. And what we learnt from this project was to challenge some of the service stereotypes around engagement. There were myths that they would not be able to talk about their feelings or be psychologically minded, or a white woman wouldn't be able to speak with them and engage with them, or they would engage with a black man. We were able to make relationships, build relationships in collaboration with the community development workers and community groups to dispel some of those myths around engagement.
My involvement with this project has been the work that I have led with the support of a vast number of clinicians and managers in developing a business case for acute hospital liaison services. We know that about 50% of people, at least, of older people who are admitted to hospital have mental health problems, and yet the vast majority of those people are not detected and therefore don't get the treatment that they need in a very busy acute hospital setting. Our business case is working to try and develop a multidisciplinary liaison team that can work with teams of hospital clinicians in improving the care of those people.
The bit of the project I've been involved in is the work with the memory assessment service and the memory clinics. So I've met with all the managers and clinicians involved in those services and listened to them about their frustrations about how they'd like to do it, but how they feel as though they're trapped by the system, if you like, in the way they have been doing it. Now, what's been very interesting in that is all 5 services that we run in 5 different towns, they've all got similar problems and similar frustrations. So they all describe what they'd like to do, but what they've actually been doing is somewhat different. So what we've done in the project is propose how we could get out of that trap and get to use our expertise in the most valuable way to the benefit of the people who need our services.